Good morning. My name is Brad Holland. I'm the CEO at Hendrick Health System, and it's good to see everybody this morning. I want to start by thanking the county commissioners and the city leadership, Robert Hanna and Anthony Williams and the judge and Commissioner Statler. Thank you all for the collaboration that we continue to work on. My colleague and friend Mike Murphy at Abilene Regional Medical Center and myself are working very closely on looking for what the community needs as this virus spreads through Texas. I am happy to report that all statistics appear that Texas is flattening the curve, but it also appears that what we're doing in Abilene is flattening the curve. So what we have advised the city and the county is that what we're doing is working. We are very supportive of extending these guidelines because what we're seeing is there's approximately 40 to 45 positives in the county at this point, and that is a 7 or 8% growth rate from the first case on March 24th. Unfortunately, there is a growth rate, and it will continue to grow. And what the hospitals are doing, working in partnership with the county and city, is modeling what that looks like. We know that the hospitals are open for business, and we do have capacity to treat this virus in people with symptoms, as well as all the symptoms that need hospitalization for unforeseen circumstances, because we're still open for strokes and heart attacks. But that doesn't mean we have endless capacity. So we do continue to need your support in what you're doing. We also recognize that we need a viable economy, and we continue to support buying local and supporting our local shops and vendors and restaurants, which is why at the hospital we've stopped internal catering, and we're using all local restaurants for all services that we continue to have. We are also having a no visitation policy, just like the jails. That is a governor mandated. That is very difficult for families and loved ones. At the hospital, we are following the CDC's guidelines, which basically encourages use of masks. And it's not because masks keep me safe. By me wearing a mask, it keeps you safe. In a hospital, we are more susceptible to COVID-19 maybe than anybody because we are around it more than most. So at the hospital, we are requiring all personnel to wear a mask at any point in time. That doesn't mean that means if you work in the ICU, in our coffee shop or the gift shop or environmental services or administration, you will be wearing a mask. This mask is one that was donated from the community. And so whoever sewed this nice denim mask for me in administration, I appreciate what you're doing, and this may have kept you safe if I come in contact with you. So thank you. I'd also like to talk about the hospital here at Hendrick, and we have seen about a 50% decrease in the volume. If that is when the governor required us to cancel elective surgeries, we started closing outpatient facilities and reducing volume to free up PPE, as well as staff to meet a potential surge. I use the word potential because at this point we don't know, but we are ready to meet that need if it should occur. With that, we get lots of questions about what the hospital is doing with our employee staff. First of all, I'm proud to report that every employee, regardless of what sort of patient you're treating, COVID or non-COVID, we are requiring full PPE, masks, face shield, the works. That is because we don't have the bench strength in our organization to have our employees get sick. So if you come to our hospital, regardless of your diagnosis, because it has been determined that you could be asymptomatic, we are requiring all of our caregivers to treat you as if you are COVID-19, because that is what we're going to do to protect the employee workforce at Hendrick. That is something that we're very proud of that we've been able to do. We've been able to do that through generous donations from the community, and we'll continue to do that. So if there was something that I could ask from the community, it would be to continue to bring and sew masks. That's something that allows us in non-patient care areas to continue to wear, and that allows the formal medical PPE to go to the caregivers and keep them safe. We know we're early. With 40 diagnoses approximately in this county, this is the time that you're going to be able to prevent a surge. And so if you look at timing perspective, this is the time to double down on what you're doing today. With 40 community virus patients out there, there's presently 8 in the hospital, 1 in the ICU, and 7 on a designated floor to treat this virus. We have about 6 test cases pending, and we often get asked, what is the ages? And I can tell you at this point, the ages in the ICU are around 60 years old. They do have comorbidities, but again, it just demonstrates that no one is immune from this. Financially, Hendrick Health System is in good shape because of the conservative nature of our board, but this is taking an economic toll on Hendrick as well. With 50% of the volume decreasing, that is a financial hit. So healthcare is not immune to the economic challenges that each of you are facing in your business. The Board of Trustees and administration have made a designated effort and communicated this housewide that we are not going to lay off staff or do furloughs at Hendrick. Now, there is chances, and most likely people will have reduced volume if there is reduced work to be done. So there is a likelihood of reduced hours and reduced pay at Hendrick. But we are making the designated effort not to lay people off or do furloughs because as a leader in healthcare in a conservative business, we've been fortunate to be able to do that for an extended period of time. How long this virus takes, we're not exactly sure. No modeling has been successful in identifying what that is. I am happy to report that it seems to be working, what we're doing in Abilene, and this is not the time to let up because we hear in New York that the peak, quote, may be over. It is apparent that Texas lags, and how far and how much that is going to be up to us as patrons. I encourage you to use the face masks, not for yourself. Again, it's because you are respectful of the people around you because you may be a carrier unknowingly. I'd also like to talk about our flywheel. This is our COVID treatment and screening protocol. If you or a loved one have any concerns, we encourage you to call the COVID line. You will go through a screening tool. And what we're seeing in this market is it's not about travel anymore. It is community spread, and that is the bulk of what we're seeing. You will call this line, it'll screen you, and then we have staffed a 24/7 hotline, and you can talk with one of our caregivers, and they will direct you to the appropriate screening location for flu, strep, and potentially COVID-19, and direct you with quarantine instructions or direct you to the nearest care setting. We at Hendrick have started doing in-house testing. Up until a couple weeks ago, we were using and dependent on third-party labs that the labs may have had anywhere from 2 to 7 day turnaround. And as the labs got busier, the turnaround time extended. I am very proud of the lab staff at Hendrick working proactively. We have a machine called Beck & Dickinson, and that machine now has us the ability to have collection kits where you swab as well as the test kits that we can run on that machine. We are now running about 20 tests in-house a day. So at Hendrick, we're able to control our own ecosystem. We're able to screen you, we're able to swab you, and we're able to get test results within a day. And if you need hospitalization, we have the capacity and the safe staff to treat you. Thank you for your time, and best of luck to everybody.
Good morning. Thank you all for having me here. My name is Mike Murphy. I'm the hospital CEO at Abilene Regional Medical Center. And I want to thank the mayor and the county judge and commissioners and especially my longtime friend Brad Holland for working so collaboratively on this health crisis as we face it. So I'm a hospital CEO, so I recognize the focus of my job is to prepare for as best we can the COVID-19 crisis when it hits Abilene. I do recognize, though, I think we all recognize that the challenge that the leadership at Abilene and Taylor County and the state and national government have, their challenge is to balance the economic hit that will be incurred or is being incurred by shutting down restaurants and countless other businesses and the impact that has on the local economy, to balance that with the absolutely certain, in my opinion, increase in COVID-19 patients if those restrictions are lifted or even relaxed too much too soon. So I'm supportive I respect the decisions they have to make, but I do want to, as Brad noted, continue to flatten the curve and extend it out, and if we can, to the extent we can, push out whatever surge that we get. It's clear that we're going to lag New York. I don't know when that's going to be, but the longer that we can push that surge out, the better prepared we can be. Like Hendrick Medical Center, Abilene Regional is prepared to take on the patients. We have, just to give you a snapshot, the numbers are very fluid, but the snapshot for us this morning is we have 6 patients in-house in our COVID unit, 2 are positive and 4 are pending results. As Brad noted, the testing turnaround time has gotten a lot better. We do not have the ability to do that in-house, but the turnaround time for our testing has been shortened from probably an average of a week to 2 or 3 days. We do look forward to collaborating more with Hendrick Medical Center when they get completely up and running with their in-house and have the capability to handle our testing volume. We'll collaborate with them on that as well and have it self-contained in Abilene. We look forward to doing that. Our focus in the next days and weeks ahead is to continue to look at the shortage areas. You know, the things you hear about the PPE that we're trying to conserve. There's definitely a nationwide shortage of PPE and of ventilators, although I think we have that covered. Of beds, you know, we're working right now at Abilene Regional to open our 5th floor that's been closed for a few years, and we're looking at steps beyond that. Where else could we put beds if we needed to in the community? And we had a good meeting yesterday with the county commissioners and the mayor on where those options might be. We'll continue to work on that. We do think that we're fairly well prepared, but we'll take advantage of the days and weeks ahead to continue to prepare to try to do the best job we can when that surge hits. I want to thank the community for supporting us. I think the county judge mentioned the complaints about not being able to visit prisoners. We have the same complaints. Hendrick and Abilene Regional have both severely restricted visitor access. That's for the patients, that's for our patients, that's for our employees, and it's for the public. And we'll continue to do the things that we need to do to try to make our place as safe as possible. I want to thank you all for everything you're doing. I want to thank a number of community agencies and folks who have brought us not just PPE, not just masks, but food over the last week. We've gotten hundreds of pizzas and other meals. We continue to buy meals from our local restaurants when we can for in-house meetings, but we do appreciate the outpouring of love from our friends and neighbors in Abilene. Thank you very much.